Okay, so we're actually looking at the next this not next, right? This is like our first video, okay, as we start talking about respiratory distress syndrome. So this is the introduction to the whole concept of respiratory distress syndrome. Okay, so introduction to respiratory distress syndrome. So that is a serious condition. It impairs the ability of your lungs to be able to continue exchanging oxygen, okay, and carbon dioxide. So ultimately, it will lead to what? Your respiratory system failing. You're not being able to exchange oxygen and carbon dioxide again, okay? So it can happen in children that are born before time. It can also happen in adults, okay? So for both of the conditions, we'll get to introduce it, okay, differently. So the one happening in newborns is usually due to their lungs not being able to produce enough surfactant. So that surfactant, it should be here to be able to keep the lungs, the alveoli, widely open. You understand? If the surfactant is not there, you can have the alveoli collapsing on each other. You can also have accumulation of fluid, okay? So it will lead to what? Difficulties in breathing. So the child is having difficulties in breathing. As they are breathing, you are hearing some sounds, that are grunting sounds, nasal flarings. Then because oxygen distribution is not adequate, you are having their skin becoming bluish, okay? So what will actually cause this issue is what? Prematurity, okay, and diabetes. Okay, so treatment is continuous positive airway pressure. Okay, so it basically helps the person to breathe well. Then since they are lacking surfactant, that's in the newborns, you can actually replace some drugs that like is man-made surfactants, okay? Then supportive cares. So the ones in adults is usually caused by what? Lung injuries, like the person has pneumonia, aspiration, okay? Or indirect injuries like sepsis, trauma, or pancreatitis, okay? So it involves widespread inflammation, so the lung tissues got involved, okay? So there's difficulties in breathing, there's rapid breathing, the person is finding it difficult to breathe, okay? And their oxygen levels are low, okay? So diagnosis, they just diagnose it and know the stage based on what? The levels of oxygen that your body is still being able to maintain, okay? So treatment is simple. The person is having difficulties in breathing, so you help the person breathe better. Then you tackle the underlying cause, okay? So depending on what is causing the issue, you tackle the underlying cause, then you help to solve it.